We found an empty Percocet.
What the hell are you doing? What are you calling?
He's been uncooperative and combative since we picked him up.
Stop fighting. Calm the fuck down or I'm calling the cops.
My meds at home aren't working. Please, I have sickle.
Okay, stop. Everybody stop.
Ah!
What's your name?
It's Joyce.
Joyce, is this your sickle cell pain?
Yes.
10 milligrams of IV morphine.
You really want 10?
Yes, repeated in 5 minutes if needed. And she needs a dilaudid drip. This is a vaso-occlusive crisis. I'm so sorry this happened. Are you okay now? We're safe here.
So this scene is from the new TV show The Pit on HBO. While medical dramas a lot of times dramatize stuff and none of it's really accurate, this scene is 100% on point. As a hematology fellow, we see sickle cell patients all the time. I literally see one every single day. To quickly explain this in layman's terms, sickle cell is a disease of your red blood cells where the shape changes from a normal circle donut shape to a sickled shape, like a moon crescent shape. And when that happens, it doesn't flow through your blood vessels properly and causes occlusions. It blocks it. And when those blood vessels get blocked, they lose oxygen and they start to die. And so it causes a lot of pain. And people get a lot of joint pain, hip pain, shoulder pain, and a lot of abdominal and back pain and chest pain as well. It is extremely painful. You need high-dose opioids to control these patients' pain. The unfortunate reality of sickle cell is that it predominantly affects Black African-American patients, and so people have a lot of biases towards this group, and they say, oh, they're all drug users, they're all opioid abusers, they're just coming to get to the hospital, like I'm getting high. That's the exact opposite. These patients have probably been suffering from this disease since the day they were born, going through sickle cell crisis, pain crises throughout their whole life. So if you go to a hospital that's not used to sickle cell patients, they'll get treated like this. They'll get treated like drug abusers. Do you know why? Because drug abusers know what exact drug combination they want to get the high. Sickle cell patients who also go through this know what drugs combinations work. Benadryl, Dilaudid, morphine. They know exactly what drugs help control their pain. And so people assume that they're just drug abusers. It's extremely sad, and I feel so bad for these patients because you can look at the pain in their eyes and you just wonder how anyone could treat a human being like that. So the first thing I do when I get a call from the emergency room about a sickle cell patient, I say aggressive IV hydration. You want to bolus them with tons of fluid, hydrate their body. And then I say liberal opioid use. And if they give me pushback, I just say admit the patient under my name. You're not taking care of this person anymore. Because I give them high dose opioids to control their pain. The pain is extremely real, and you need a good doctor who understands the disease to take care of these patients. And if you're not careful, a lot of medical emergencies can happen, and these patients can die in the hospital. So you need a good hematologist, you need a good emergency room, and you need good internal medicine doctors or primary care team to take care of these patients. And I think this show did a great job of expressing the aggression the doctor needs to show anyone who interferes in that patient's care. And I really love that. I'm truly passionate about this patient population and that they need to be taken care of properly.